So yeah, this is today's video is basically going to be a live stream on what it's like to prepare for a hair transplant. Now, I've had 6 myself, so I've gone through the whole scope of, preparing for a hair transplant, the aftercare, all of these sort of things, what it's like. And it is very much an evolution. You will learn things along the way and pretty much adapt the approaches as time goes on. So in this live stream, I'm going to tell you everything that I would do to prepare for a hair transplant. Now, you don't have to listen to me. At the end of the day, I'm not a medical doctor, but I'm a patient who's gone through this 6 times and who has come out the other side. So I think it is interesting for people. So please chime in if you're going to have a hair transplant, or if you have gone through a hair transplant yourself, offer some advice, this sort of thing. So with a hair transplant, the very best preparation, to be brutally honest with you, is to, from the beginning, select the right surgeon. And we'll touch on that briefly, and then, talk about some of the more, realistic things of what do you have to do, assuming that you've already picked your surgeon and all this. So in terms of selecting a surgeon, it should be flawless if you're going to a clinic that has the 1 case under that doctor per day ethic, and who is going to look after you from start to finish. There's no separation of, one guy's doing the extractions and another guy's doing the hairline. None of this. This is Turkish rubbish. What it should be is a practice of medicine, which is you come in the morning, you meet the doctor immediately. It's his practice, and he takes you in, then goes through a thorough consultation himself, brings you into the operating suite. He does the design himself. He does the harvesting himself, whether it's FUT or FUE. And then he's there to, supervise the placement of those grafts. He has to make the sites as well, because this is the artistry. So it is essential that you're going to a medical doctor clinic, not a kind of chain, not an Instagram clinic, not one of these places, And if you do this, I promise you, it should go flawlessly. And again, provided that surgeon is an ISHRS fellow, all of these sort of things has been in practice for, at least a decade. Should be longer. Maybe they're an American Board of Hair Restoration Surgery diplomat. They respect the donor thoroughly. You've looked at their work, and no harm is done, only good. And they're posting pictures of their cases, their portfolio, from, repair cases to guys who are younger to older, and they're not just showing you hair porn on their website. That's really important, that they're honest. That's how you go to a good hair transplant surgeon. And then it should be fine. So if you make that decision and you selected the right surgeon to begin with, that is the most of the work done. But there are some things that you can do to prepare for a transplant that we're going to go through in this video. And that includes, firstly, reading over the pre-op instructions and adhering to them. You're going to see some things such as, stopping alcohol prior in advance. If you take minoxidil, it's important to stop taking that about 2 weeks in advance, because it increases graft pop-out rate in surgery. It makes implanting those grafts a bit more slippery, and that will add a lot of time to the transplant, and that's going to fatigue the assistants. If it's topical minoxidil, there's going to be a period when you can resume that after. If it's oral minoxidil, it can be taken immediately the next day. And I think it's very beneficial to do that. I'll discuss some of the post-op things that I personally do. But what I'd like to start out by saying is, I've done this so many different damn ways. And, from staying only a couple of nights in the country to staying for 3 weeks in the country. I think the first thing I do is when you're planning this, and I'll get to the chat in a few minutes, I would undoubtedly stay in the country if it's FUE for minimum of a week. But if you can stay a bit longer, I would do so. If it's strip, I would stay in that country until you have those stitches removed at the clinic, which is going to be at day 10 or day 11, maybe even day 12. But don't leave the country, within 72 hours. I think it's a bad idea. You're going to, trust me, after you've done a transplant, you're going to be so tired, you'll want to rest. And it's important for your body to rest. In terms of healing. If you are under stress, you're going to raise cortisol levels. That's going to impact the healing. But you're going to have, you're going to have stress and anxiety if you board an airplane and have to go through an airport after you've had a hair transplant. I can't think of a worse nightmare. Because you will look like a freak show. Everyone will be staring at you, and that's going to be in your mind. Why would you do that to yourself? So my advice is take the time to recover in comfort. Book a really nice room in a hotel and treat yourself. Book a suite. I do this every time. The first time I ever did this, I spent only a couple of days in the country. Huge mistake. After that, I stayed for 2 weeks. Then I tried one time staying for 3 weeks. This is too much. But 2 weeks, I think, is, for me, this is perfect. And, rent out a suite. Spend a few €1,000 doing it because you will live in comfort. You will be more relaxed. And it's a long time to be in a hotel suite, but trust me, I do patient coordinating as well. I know what it's like for the guys. They don't want to leave the room. They're not going to be walking around that city within the first few days, taking in the sights and going to restaurants. It doesn't work like that. They hibernate. So you might as well book a very comfortable place and take care of yourself. And that is my advice. This is an investment. And it's going to cost money. I've always said it's a luxury cosmetic elective. You are luxury. You should be treated like luxury. So invest in your accommodation. This is my biggest tip. The next thing is for the transplant, to prepare for it, wear buttoned clothing like this. Because if you have hairline work or temporal peak work, what's going to happen is if you wear a pullover, a t-shirt, whatever it is, when you pull this over your head, you can dislodge grafts. And I've seen it happen, unfortunately. So you have to be very careful to bring buttoned clothing. And pack the buttoned clothing for 2 weeks, But especially, it's imperative during the first 72 hours because after 72 hours, the grafts connect to the blood supply and you're kind of out of the first stage of where you have to be very careful. But at day 12, 13, this timeline, the grafts are really fully secure because fibrin is released at the graft site. So they're 100% anchored, And that's why I always wear button clothing right up until the 2-week mark. I, during that time period as well, will never use a power shower to wash my hair. And I will either have a bath or I will use the shower everywhere else. But I only wash the hair at the sink, where you'll be shown how to do this. You have a cup of water, just lukewarm water. And you're going to pour it over your head. You're going to wet the area. You're going to apply a mild shampoo to it. You're going to be careful, use common sense not to wash your hair as normal and touch the grafts. You're just going to very gently get some suds lather and you're going to pat it down. Leave it for a minute and then you're going to rinse it off and then it's perfect. And I do this for the 2-week period. I treat it like a baby, like it's a burn victim almost. But in the other areas that haven't been transplanted, including the donor, I using common sense, I ramp it up and I can massage it and be careful and keep it very clean. That's important. Another thing with preparing for a transplant is just to know what's coming. Is your post-op instructions are going to differ from clinic to clinic, and it's important to follow them because guys, physicians have different protocols that work for them, and they wouldn't utilize them if they didn't work. Unless, again, you're going to a subpar clinic where, they have a protocol that might not be within your interest. In some of these hair mills in Turkey, some of the stuff they do is nonsense. But a great clinic is going to have a custom post-op protocol that should be followed. What I do is a little tip. With spraying in the post-operative period, within the 24 hours following the transplant, my waking hours, I'll probably spray it every 2 hours, maybe every 3 hours with the normal saline. And then the next day, about every 3 hours, keeping it clean and moist, because when a wound is wet as well, it will heal better. And when I get halfway through the saline, I replenish it with tap water, even though it's not sterile, it doesn't matter. It'll work fine. And I dilute the saline down, because if you spray too much with the saline, it's a salt. It's going to make it itchy, and it can increase the likelihood of you scratching it during the night and potentially losing a graft within those first 72 hours. So I dilute it until eventually, after a couple of days, I'm at 100% tap water, and I'll continue spraying it to keep it clean and moist because it heals better in the recipient up until about a week. Another tip is utilize room service in a nice hotel and make sure you're well fed. So contemplate that in terms of finances, and stay very well hydrated. I will drink maybe about 3 jugs of water easily from immediately post-op for about a week. And I'll have some fresh juices and all this to keep sugar levels up. But I stay very hydrated because, you have so much in your system in terms of medicines you've been given, anesthesia, all of these things. And it's good to increase the excretion process. So I stay very hydrated during that time. I think it's very effective. And I said I take minoxidil as well orally from the next day, because it's a vasodilator. So logically, you've had a hair transplant, there's trauma, you're going to get the classic wound healing response, and you're going to get all the growth factors going to that area. If you take a vasodilator, it's going to catalyze this effect. And I think that's very beneficial. So that's why I especially adhere to minoxidil, but I actually increase the dosage to about 2.5 mg in the morning and 2.5 mg in the evening for about 2 weeks. And I believe it grows a bit better in terms of it comes in a little quicker and it recovers better and there's reduced redness. I've done it without minoxidil. I've done it with minoxidil, 2.5 mg, and then I believe that ramping up to dose 2 a day for that 2-week period brings a hastened healing response. Another thing that might be discussed in preparation for your hair transplant, and this is quite important, is guys smoke, and they will say don't smoke cigarettes for about 2 weeks before your hair transplant and abstain about 2 weeks after your hair transplant. And of course it makes sense. But I can tell you, just as an account, because I know people stress over this and people have asked me this a lot, so that's why I'm covering it. And I'm not encouraging it, but look, I'm a smoker. I've smoked for 13 years and I know the addiction, and you want a cigarette, and I've seen it in guys, if they abstain from smoking, they get stressed and their cortisol raises, and it's sometimes counterintuitive. I've done a transplant where I haven't smoked for months in advance and abstained for months after. I've done a transplant where I haven't smoked for about 2 weeks in advance and abstained for 2 weeks after. I've done a transplant then where I have smoked immediately post-op. The damn thing grows every time. Perfectly fine, in my opinion, in my experience. And in friends who've done it, I can see the exact same thing. It grows. So guys who are very concerned about cigarettes and are panicking and stressing, look, if you have a few cigarettes, just use common sense. Bring it down. Bring it down, limit it to just a couple a day if you absolutely have to. The thing isn't going to fall out. It's still going to grow. Ideally, you wouldn't smoke, but this is not real life. Sometimes in life, there are smokers and they need to do it. It's their relief. So I empathize with that. However, I would say, don't vape, because vaping is probably way worse, because you're going to take in far more nicotine. Because I know it with guys, they're vaping every 10, 15 minutes and they're chronically exposed to nicotine, which is a vasoconstrictor. And the conversion rate is higher as well. So, and as well, if they're getting, these vapes from the US, some of these have far more nicotine in them than an EU vape. So do not use electronic cigarettes. Far more harmful to be doing that every 10 minutes than having, let's say, 4 cigarettes in a day. This would be how I would look at it logically. So yeah, these are a few things to consider. I'm going to take a look at the chat now. But if you're having a hair transplant, just prepare for that post-op period. You're going to bunker in. So book a nice room, book it for, minimum of a week, but preferably 2. Ensure that you have the button clothing, have the finances for as much food as you want, and follow the post-op instructions to a T, and everything should be fine. It's pretty simple to go through. But a lot of guys will panic over it. So I'm going to take a look at the live chat, because I see we have quite a few comments, and get through them. Hi, could you advise how to sleep during healing after FUT? How to prevent damaging both the scar and grafts? That's a great question. I will be so honest with you. I have done a good few strips. You are not going to sleep. It is a painful experience. You will not sleep until those stitches are removed. And the best way to sleep with an FUT is lying on your back, getting through it. Maybe, having a pillow for your neck can help as well, because even when your FUT that is been done a few days after, if it touches a soft pillow, right, it's sore. It's very sore. It's about an 8 out of 10, and you can feel the stitches pulling. I've been over in Wrocław, and I was with a guy once who was staying with me, one of my closest friends, in my suite, and he was in agony doing the strip, and he wanted painkillers, and every time he touched the back of his head off of a pillow, he was in agony. And it can be like that. It really is not an easy thing to go through. But as soon as those stitches come out, it goes back to normal. So yeah, unfortunately, my advice to you is make sure you have the painkillers, and consider the neck pillow. But I will tell you one thing that will lessen the effect of pain, and that is the donor scalp laxity exercises. So again, having gone through this, I have gone through periods where I've done the donor scalp laxity exercises a lot, and then I've gone through periods where I took my foot off of the gas, and that was a mistake. And the donor scalp laxity exercises are, these exercises, I have a video on it where you're moving the scalp, you're mobilizing it on the fixed cranium up and down, this sort of thing, and you're making sure that you increase the laxity over about 2 months to 3 potentially, if required. But you do it about twice a day. 10 to 15 minutes is perfectly fine. They really work. They increase the laxity, and thus when you do a strip and you close it, you have less tension, and it's less painful. But if you don't do them, it can be very, very painful. But this is especially applicable in repeat strip cases. Your first strip, of course you should do them, but your first strip is not going to be that painful. Your second strip, it'll only get worse because there's more tension. But by doing these donor laxity exercises, it will minimize the tension there, and thus it'll be less painful. And as well, it will increase the propensity of you having a far better scar. So consider them. What else do we have? Boof, Juan, I love this guy. Juan was the guy who started my whole YouTube journey many years ago. You should check out his channel. He's here in the chat. Move things around to make sure you do nothing to lounge around all day after surgery. Typically, you're going to be excited afterwards that you'll feel like going to the gym. Don't do it. That's so true. You'll be elated with endorphins, and I see it with guys. They're constantly smiling, and they're looking in the mirror like 100 times a day. Now, even the more transplants you do, it gets a bit number. The excitement, it dials down, but it's still an endorphin release. And he's so right. You'll want to eventually go to the gym and do all of these things. Take it easy. Use common sense, and remember that especially if it's an FUT, it's not healed. And you have had that area opened. A strip of tissue has been excised. It's been sutured up. It needs to heal. So take things easy. Avoid doing things that bend down. And listen to your body. Anything that causes pain here, anything that you will know, anything that makes you alarmed in terms of movements because your body has gone through, trauma, listen to it and take things easy. That's the best thing to do. Dallas says, oh dear, I was vaping like a madman post-op. If it's done, it's done. And again, I'm sure the thing will still grow. But my advice is, out of the two of them, there is a lesser of two evils. And vaping chronically, as we do post-op, because they say use electronic cigarettes if you're a smoker, that's 0% nicotine. But guys don't think about that, and they just use a 20 mig or a 50 mig vape, and it's not a good idea at all. But look, I'm sure it will be okay. I wouldn't worry too much. Is FUT a good idea if you only need 1,500 grafts, says Finn. Yes, absolutely. I have my first transplant ever was 1,500 grafts by the strip technique, and I had an amazing result from that. And the donor area healed impeccably. I got a very thick final result from this, but the impact to the donor area was absolutely minimal. And I was able to do, a number 2 haircut over that donor region here, and nothing was visible from the 1,500 graft strip. It was the best decision I ever made. And it was my first transplant, which is so important because I didn't introduce 1,500 scars into my donor area. The first transplant is a domino effect. It's going to dictate everything. It's going to dictate the trajectory of your future surgeries. So consider that. Go with the strip. Trust me. Hello, John. John is a great mate of mine who lives not too far from here. I might catch you later, actually. I didn't realize he was into hair. So Juan says, FUT hurts more short term. FUE discomfort less, but for longer in the donor area. That's so true. FUT, it's kind of like, no pain, no gain. And you go through this short term, 2-week period of discomfort, serious discomfort, and you have lifelong results that are better, and a donor that isn't over harvested, and a donor that's thickness is maintained. And these, the follicles from the occipital area that have been removed and put in the recipient sites that are going to last longer, they're going to withstand the test of time better with FUT. So you're going to get a better result with it. So it's worth that pain short term. It really is. You'll never look back. And, let me tell you something. This is very interesting from, again, someone who's done both FUT and FUE. And Juan's done both FUT and FUE, so he might be able to confer as well on this. After you've done a strip and it's healed, right? When you touch the back of your head and you feel it and you run your hands through your hair, it feels the same. Now, that is because the density is preserved and the scalp has just been realigned. So there's in no way has the density been reduced artificially, where you've reduced anything above and below into the sides of that incision. Now, when you do FUE, while it's short-term discomfort, and it is very manageable, you will find, though, that in the coming months, this kind of prickly sensation as, some of the nerves are reconnecting and all this. And it can be quite itchy. But what I don't like about it is you will find that even when it's fully healed, when you run your hands through your donor, you can feel that it's been altered, not just the scalp, the hair itself, because someone has come in and, removed groupings of hair. And the donor is not this natural uniformity anymore. So when you rub your hands through it, it feels permanently different to how you remember it. And I don't think that is a good long-term thing to live with when you don't have to live with it if FUT is picked. That is just my 2 cents on the matter. I feel very strong about it. I really do. But consider that. So do you want to go through, some short-term discomfort? Wear it as a badge of honor almost for long-term value, where the trade-off is so minimal. You have this result and you have the back of your head that looks the same and feels like you haven't had a hair transplant. I think it's wonderful. Remember, I've done both techniques, and I have done FUE twice and FUT on 4 occasions. So it's interesting to compare and contrast what it's like living with these. But isn't the best plan of attack to make several FUTs over the years? And then if your scalp tension is too high, you still have some FUE grafts left. Yeah, that's exactly it. So you're utilizing FUT first to build. You're getting 100% of the sweet spot, as they call it. And every time you do it, you're not going into an area that has been, Swiss cheesed and looks like someone put a shotgun to it, but it's scarred up by FUE. Because as you do a second strip, how it works is they incorporate the old scar into the new harvest. And then they can do it a third time and potentially a fourth, but a third is plenty, believe me. And that way you're left with just one scar, and you take all of this wonderful hair. And when you're stripped out, you can then go to FUE. Now, if you require a small session in between that's a couple of 100 grafts, you can, again, do the hybridization and do some FUE. I've done that. It's perfectly fine. And I actually think it's, it can be a great taste of what could happen if you were to do thousands of grafts of FUE. I got to taste what it's like to do FUE with 1,000 grafts. And then after that, we did strips and we cut out probably 50% of those scars by this stage. So I'm left with less scarring now than I was post my second surgery when I did the FUE. So it gave me a sense of what it's like. And I said to myself, I will never, ever do this in the thousands. This is not for me personally, because it doesn't match what I personally value. That is not, of course, transferable to other people. Some people are not bothered at all by this, and some people have no issue with thinning the donor or having scars. They're far more bothered by the idea of a strip scar. So this is why it's case dependent. And, when candidacy is for both techniques, it's a personal choice that is made in discussion with the governing surgeon. But it's good to think about these things before, trust me, and get perspective. I only went down the route I went because I was reading up on these things prior to my hair transplant. I'm not reading up to death on it. I take action. I'm pragmatic, so I don't sit on the fence for years and years. piss or get off the pot, this sort of thing. So I spent about a year reading about these things and listening to arguments and looking at a lot of photos and using my eye. It's very important to use your eye to notice what's good and what's bad. And I became obsessed with the donor area, and I listened to a lot of Dr. Feller's arguments, and I thought, my God, this guy is so right. And then all because of that, I selected, in my head, I was like, I'm doing strip. This is the way to go. And then when I had the, privilege of finding my hair transplant surgeon, and then he took me on as a patient, and, I was a candidate, and the rest is history, And he did both techniques, and we had a conversation about it, and went with the strip. Okay, just back to this. Lewis says, I'm going for my first transplant next month. Is there any you say is a must do? I'm already on finasteride and minoxidil. The must do is make sure that just two things. I hope, because it's your first, it's not as important, but it will help. Do the donor laxity exercises. I know you've only a month left, but it's going to help with either the extractions in FUE or especially in your harvest with FUT. I don't know what technique you're going for. I'm curious what it is. It's probably FUE, but please let us know. And the second thing is, this is the most important thing. I hope that you are taking the adequate time for yourself to recover, which is a minimum of 2 weeks from work. And you can cover this by a medical certificate. I know we can do this in the EU very easily. I've been off for a month before, because you're going to look very different, and you're not going to be terribly in a rush or comfortable going back to the working setting. And even if it's remote, I don't know what you do for a living, but if you're working at a laptop, your head is going to be like this. It's not great. So take the amount of time out of work, as the more, the better. But minimum 2 weeks, that's my advice. And if you're doing it in a foreign country, again, consider really extending your stay to more than a few days before getting on that aircraft to come home. I'd love to know what country it is and some of these details. It would be great for the chat to for people to see. Is the minoxidil orally, says Finn. I'm not quite sure what you mean in context, but do I take oral minoxidil? Yes, indeed I do. Or can minoxidil orally be taken right after your transplant? Yes, it can, but topical can't. There's a timeline before you can get back to the topical that will be stipulated in the post-op instructions. It's going to be a bit different from each physician. You need to get off of it 1 week pre-OP. No, 2 weeks. You need to be off of oral minoxidil for 2 weeks. If you get off of it a week, of course, it's going to be better. But if you get off of it a week, you're still going to have some slipperiness to the grafts. I made this mistake. And I've seen what happens when you don't get off of it. 2 weeks is the number where it's required for, the transplant to just go completely normal and not be affected by this increase in graft pop-out rate when they're implanting. How do you get these fine single hair grafts that you need for a hairline when you take a strip from the occipital region? There's singles in a strip. So, the beauty of a strip is, think about it as equilibrium. So while some of the singles will be a bit thicker than singles, closer to the nape, it's a balancing act. You have thicker hairs anyway, so you have the singles in the front that, will be perfectly fine and will be a bit thicker than ones that are found again in other areas, like close to the neck, above the ears. But then behind it, you have very thick hairs from that occipital reach. So it's in balance. It's in, it's synchronization. And aesthetically, it looks, harmonized. Whereas if you had these very, very fine singles placed in the front and then these very thick hairs behind, they're going to be a little discrepant. They're not going to flow as well. The beauty of a strip is it gives you a strong hairline, but it can be very natural. And those singles are going to withstand the test of time. Whereas singles that are going to be taken from lower down in the donor area might not be there in 10 or 15 years. And that's going to look odd. That's where you're going to have to go back for a transplant and top it up. You can easily create a very natural hairline via the FUT technique. I had a really refined hairline. I remember in my first surgery and in my second and my third and my fourth and so on. But it is a bit thicker now than it was in my first, because as we go higher in the occipital region, we're taking hair that's even thicker. So, that's why it kind of looks like this. But my hair is wet at the moment, although it's probably dried since I've started the live stream. But this is just wet and it's kind of, slicked back a little bit. It is drying, I feel it actually. But, this is composed by FUT. Which doctor is the best for Norwood 7? I don't know, I'm afraid. And I never really like doing these answers on air. It's best to, your best thing to do is to go to a surgeon that hits that criteria where, again, the one case per day, doctor-led. If it's a Norwood 7, they should probably have about 20 years experience, and they should have a portfolio dealing with cases for these individuals who are higher on the Norwood scale. But, should someone who is so advanced on the Norwood scale, like a Norwood 5 even, Norwood 6 be having a hair transplant? Are they a candidate? Because they're going to, in all likelihood, get a result that is, going to be composed of donor that you can only imagine is not very robust and might make them more unhappy than if they didn't have surgery. Of course, these things have to be decided in person by a surgeon at the end of the day and seen. But a lot of people who are very advanced in the Norwood scale, and if you're young, are typically not candidates for hair transplant surgery. Not everyone's a candidate. And sometimes the best thing you can do is not go forward. It's for, you can get a transplant. If you're not a candidate for a transplant, I can tell you, you can go and you can have a transplant very easily with someone who will operate on you. That's the problem. That's the problem with affordable transplants now. They'll do you, no problem. They'll take your money, but they will cripple you for life, especially if your donor is going to continue to thin and you're not done receding, and you'll be left with a mess. You'll be left with something that looks so artificial, that is going to be disconnected, that will, again, psychologically severely handicap you. So it is a very good idea to have that assessed by a highly experienced surgeon. So I would start contacting them to get assessments. DK says, I have a question about hair that you might help answer. I have had a hair transplant 3 years ago. The hair transplant went really well with 6,200 grafts. They told me that they will transplant more in front than in the back. As they did, but now I have been growing my hair far more than a year. My hair comes to my shoulders. My crown area is still a bit open, but I start taking minoxidil pills. Sorry, my vision's gone. I don't have my glasses with me, so I can't even finish reading the rest. Did you think they'll come back? So, okay, that's a lot of grafts, and if your crown is opening up, I can't imagine. I assume this was done by the FUE technique. So I can only imagine that taking more grafts would deplete the donor further. And the crown, you see, is one of the worst areas to get density on because of the plane it's at. And it eats up grafts. It can take thousands and thousands and thousands of grafts to have a result that is satisfactory. So by taking, minoxidil and finasteride, it will help thicken up the crown for sure, provided that it's not a slick ball crown. And if there's miniaturization and it just is a little bit see-through, it can sometimes come back fully. But if it's a slick ball crown, and I mean, you can see scalp, this finasteride minoxidil is not going to make the cut. You'll need a transplant. And that means there'll be more hair to lose. And if you've had that many grafts, that might be an issue. And this is something where, it's so important. This is a great example where it's so important to already be on minoxidil and finasteride before our crowns open up. So if we're doing a transplant and we're hitting high numbers, we have a crown that at least remains intact. Whereas if we do a transplant in the front and we put a lot of weight into it, and you graft all of this area here, but you don't address here, if we don't manage this by medical therapy before the damage is been done, it's going to be a huge problem, because this will open up and we won't have the supply to meet the demand. So we have to sort this region out and make sure that this is completely stabilized from finasteride and minoxidil, because finasteride is going to, help address the root cause, which is your dihydrotestosterone testosterone issue, and then the hair loss will be slightly, it won't stop ever, but it will be retarded. And that's a very good outcome, because we can at least slow down the progressive situation. But we can further add to this by lengthening anagen, which is going to have more of an impact in this area and buy us even more time, because anagen cycles, I said before, are finite. So this is why we take our minoxidil, especially oral minoxidil. It is the more efficacious. I hope I answered your question. Sorry, I was a little confused, and as said, I have terrible vision for reading. I just don't have my glasses with me, because this was totally impromptu. What about the problem that oral minoxidil keep the hairs thick and long for quite a time, even while finasteride can't anymore, and then you will realize too late that finasteride is not cutting? Well, you see, in miniaturization, as your hair miniaturizes, the hairs shorten. Now, if finasteride isn't making the cut, and you can add as much oral minoxidil as you want, the thing is still going to eventually go. It's going to vaporize one day. So miniaturization will still be at play. You will know if finasteride isn't working, because you can have a great routine with minoxidil and have been a great responder, provided that your hair loss has been slowed down. And you'll see it in other areas where you don't really have hair loss, where you get a benefit from it. But if finasteride, for some reason, you're not responding to it, well, it's still going to go, But that shouldn't happen. Most people respond to finasteride extremely well. And remember, finasteride does not lose effectiveness over time. This is a misconception. People will say, finasteride isn't working, I'm losing ground. It's working the exact same way, provided that, it's the same manufacturing facility that uses the same, quality processes, same raw materials, all of this. It's just because it doesn't stop hair loss, and because you still have dihydrotestosterone in the background miniaturizing your hair, you cross a threshold, and you will one day perceive in one of your next anagen phases that the hair shaft caliber is thinner and that it doesn't grow as long, because you still have essentially DHT chipping away, shall we say, in the background at it. You can't stop it. And even if you take dutasteride, which a young man shouldn't be taking, there's a culture on this. It's a problem. That is an issue because, well, again, we do need DHT, but it won't stop it because dihydrotestosterone is a primary culprit, but at the end of the day, we don't really know what causes hair loss. There's other things at play. There's other factors that we just don't know. And that's why, trying to inhibit DHT to nothing is not the way forward. That will have a different domino effect of issues. It's a balancing act. So it's kind of, I hate to say it, but it's kind of like just acceptance is the best thing of, right, we can get on this medication, it'll slow things down, it'll buy us time, it'll absolutely make our hair better and make us age better than people around us who have hair loss, the guys who don't take these drugs. And then we can come in and do hair transplant surgery and use both of these things to try and get the best result possible. But it's a game of catch up, and it is a game that never stops, unfortunately. So once you sign up for this, you're on it for life, and that's why, you better do it right. You better do it with the right medication, so, oral solid dosage, and choosing sensibly the technique, and then going to the right surgeon, and then it should work out. It should be fine. Of course, provided that you don't have a predisposition to aggressive hair loss, and that ultimately you're a guy who's just balding slow. Stars should align if you make the right decisions. For a hair loss level that is between a Norwood 2 and 3, but I'm not receding, only hard thinning on crown. Oh, okay. Is it okay to have an FUE surgery? I'm 21 and taking dutasteride. No, that's a bad idea. If it's only your crown that's going and you're young, you definitely shouldn't have a transplant in that area. The guy who's a candidate for a transplant is the guy who's losing the front. If you're losing this, you're losing this, you're the guy who's a candidate for a transplant, provided that you have a good donor and that you haven't lost this. If it's the other way around, that is unfortunately not a good category, because the crown will only get worse. And at a young age, I can tell you, if you're having crown loss now, then what's going to happen is it's very likely to accelerate, and it's very likely to get quite advanced. And it'll be a black hole of grafts, as it's often referred to, where, especially if you've already, picked FUE, you're going to eat away at your donor area. You're going to be playing this horrible game of catch up where you'll get very little benefit to doing the crown. The best thing that someone could do for their crown is to bombard it with non-surgical attempts, oral finasteride, oral dutasteride if you have to, yeah. And then oral minoxidil is essential for this. I've seen a crown fill in that was pretty advanced by use of oral finasteride and oral minoxidil. I've seen this happen on 2 occasions, and it was astronomical, the difference. Remember, I also had a crown that was losing, and fast forward like 9 years later, my crown is thicker than when I was a teenager, because this therapy really works. But it is the minoxidil that is such a benefit, because you're targeting the matrix cells, delaying their aging. Epidermal growth factor, it's wonderful. You can look at doing other things, like if it's a last ditch attempt, try it. Try the laser therapy. Try a PRP. Do whatever you can to at least reignite some of the hair follicles that are at the very end stages of their hair cycling, and try and bring them back. But it's only going to buy time. And eventually, when your crown really goes and you're an older gentleman, then maybe you could look at doing a transplant in the crown. But talk to a highly experienced physician about this. I guarantee that they'll give you the best answer, and they might give you a fright as to what will happen if you go and do a transplant. But whatever you do, do not go to Turkey and do a transplant in your crown at such a young age. You're going to ruin everything. Please don't do that. Take the foot off of the gas and consider the medical therapies, and have a few chats with some very experienced hair transplant surgeons who will point you in the right direction. The gentleman from Brazil, consider traveling. I think it is an issue when we decide to do a transplant in our own country because we're confined geographically, right? I think this is a bad way to look at it. I think you should be going to anyone on the planet, wherever they live, but the best person for the job. I could have easily had hair transplant surgery at what is called the top hair transplant clinic in my country, but very simply put, their results did not make the cut for me compared to my surgeon. I didn't see anything particularly transformative. I thought, yeah, they did a good strip, but I wasn't, ultimately drawn to this clinic. I won't mention their names, but a lot of celebrities go there because they were only marketing celebrities. Yes, they did FT and FUE, but it seemed like a business. They had a HR department, they had an accountant department on site. It is nuts. So don't fall prey to being confined to your geographical location. Do your research. Pick the best surgeon that you think will give you the best result. And, again, align your value system. You should be obsessed with this thing. You should be obsessed with this and not depleting it and caring for it and preserving it. And as a result, you will gravitate towards towards some conclusions. And from these, you will select a hair transplant surgeon that matches your value system. And that hair transplant surgeon is going to be different for people. But it sounds to me like you don't want to do FUE and you don't want to go to an FUE only doctor. Well, then don't. Take the foot off of the gas. You can do this at any point in life. Do your research. Find that surgeon for you. It sounds like you should be going to have a conversation with someone who does both FUE and FUT, but travel. Turn it into a holiday. If you have to go to Europe or the US, do it. But, if you're looking to get good value for money and go to a really good surgeon, we have a few in Europe that are certainly that. We have some very fine surgeons in Europe, and they're very affordable compared to US prices. So turn it into a holiday. Come for 2 weeks to Europe if you have found a surgeon in Europe. And that'll be fine. But, don't just go to a surgeon that is in your country. I got on a plane at 23. I told nobody what I was doing, which was foolish. And I kept it that way for a long time. And I traveled abroad and did it all myself and came back. And then I did it again for a number of weeks. And again, nobody knew what I was doing. This was foolish as a young guy. I should have been telling my mates, should have been telling them, well, you don't have to tell your family. But I should have told people where I was, but I didn't. So, look around. Find that right surgeon for you. Yeah, I know the finasteride is not losing effectiveness, but the hair loss is just progressing further. Yeah, it's going to happen. I mean, I look back in photos of myself in my mid-20s and I can see the difference. I know people will see this and they'll think, what the hell is he talking about? He should be so happy with what he has. Yeah, I am, but it was insane when I was younger. And it's a loss of identity no matter what, as you're losing it. So, like I've been on finasteride a long time and I can tell you I'm still losing hair. We know this from the literature. We know it logically, but we know it from the clinical setting. Typically, at about 5 years in the clinical setting, what the surgeon will see is they see that the patient is complaining that, oh my God, what's happened? This finasteride isn't working for me anymore. And then it's just explained that, well, you've gone through progressive hair cycling, and because of your predisposition to hair loss, and whatever binding affinity you have to the androgen receptor for dihydrotestosterone, you have now crossed the threshold. And the further hair cycling, the characteristics are different. The hair is thinner as a result because it's thinner, pi r squared, there's less surface area and the scalp is visible. So unfortunately, this kind of comes to acceptance. There's only so much we can do, and we don't have a lot of options. At the end of the day, you have your finasteride and minoxidil and last attempt at tastride. Pretty much that's kind of the main ones. It makes little sense to play around with the other things that I won't even mention, because what that starts is very often a cycle of experimentation and trying loads of little things, and then you start causing sheds derived from these, and suddenly you're even worse than had you not got on them. Whereas if you just stick to the ones we know that work and be prepared for the fact that it's not going to get better, it's only going to get worse, and then pursue hair transplant surgery as an adjunct with this, and we can try as much as possible to make this frame as densely packed as we can, and then we can take a hit behind. This is my approach. So on the correct medical therapy, but having all of this 100% transplants one day, and that's me right now, and then having the permanent hair here, and when I say permanent, it changes still over time. The donor thins. The donor loses its illustrious youthful characteristics, but it ages slower in that occipital region compared to other areas in the donor. So that's my plan, get this as full as possible, which I've done, and then take a hit behind. And believe me, I have taken a hit behind. You just can't see it. But my hair is thinner here behind, compared to a few years ago, but that's just normal. And I don't need to transplant it, because the illusion is you see the front. And that's a good plan, because we can't transplant the entire head at the end of the day. It's a strategy, It's a strategy of delaying things and then deciding the aesthetic points of emphasis, where we can at least, when we look in the mirror or when we see someone and they see us, they see fullness, they see a lovely frame. They're less concerned with what's going on behind. It's hidden. You might brush it back, you might do a pompadour. There's, haircuts we can do to adapt for the future. Just to interject, if I may, I'd suggest you do natural remedies such as derma rolling and oils. If I may interject and give my 2 cents on this, I would not do this because, well, firstly, if you look at the natural oils, there's no active pharmaceutical ingredient in them, and naturally they do not permeate the stratum corneum. The only way to treat the hair follicle is with a manufactured ingredient, an active pharmaceutical ingredient, and then you have excipient, and then it's in this vesicle that can permeate the stratum corneum, so it can deliver to the follicle the active, because the stratum corneum is a natural barrier. So often with these oils, they just kind of sit there on the surface and they do nothing. As well, to medicine, you think about these actives, often they are derived, if you go back, thousands of years, it's medicinal. It's about concentration, right? It's about concentrating some of these natural ingredients. So by just applying an oil, even if there was a naturally occurring nature's active, it wouldn't do anything because it's not at a concentration to have medicinal effect. So this is why we need to go down the artificial route, the man-made route of a pharmaceutical that has an active ingredient and that can, it has a function that it is designed to, whether it's treat the follicle itself or vasodilation effects, systemic, whatever it is, maybe it directly targets the derm papilla. It's all case dependent on that pharmaceutical ingredient, but its active will have a target effect and it will be able to achieve pharmacological effect because it's designed to do so. So that's why I wouldn't do the natural route. The second thing is about the derma rolling. I absolutely wouldn't advise this because with the derma roller, you are going to do a few things. You're going to increase the porosity of your hair, So you're going to damage the cortex, the medulla, through mechanical trauma, which will lead to eventually the mechanical breakage of that hair fiber. The outside of the hair is very thin, and the cells, they're bonded by disulfide bonds, but they overlap like, tiles on the roof is the best visual analogy. When the hair's wet, they open up, right? And if you derma roll when the hair's wet, as many people do, you cause even more damage to the structure within. You're going to damage the, again, cortex medulla. And over time, the hair snaps. And that's not good. And as well, people who often derma roll, they do this way too often. They do it sometimes every day, every few days. It leads to a chronic wound response. And sometimes it depends on the depth. You might be targeting the reticular dermis, the papillary dermis, but there's fibroblasts there. And if you have this chronic wound healing response that isn't allowed time to heal, you can get a fibrotic outcome. And hair transplant surgeons in the clinical setting do find that on guys who derma roll a lot, even if it's for a year, that the scalp is harder. And as a result, it's harder to either, if some guys do it in their donor, it's harder to take grafts. And if they do it in the recipient, that is to be, they find it is harder when you're making the sites. They can feel the scar tissue. And there's a reduced chance of those grafts taking. So derma rolling is bad. Do not do it. Some guys have success online because, again, there's sense to it, but it's a double-edged sword. You have to think about this, the domino effect. And there's guys who will grow a bit of peach fuzz, but that's it, There's always crazy exceptions to the rule, but don't buy it, There's often underlying other parameters that are not being told. When people show you something online, there's an agenda very often. But logically, looking at this technique, looking at it academically, and then looking at it, what we know from the clinical setting, it's a bad technique. And it causes more damage than good. It's not worth the trade-off. With the natural remedies, it's as Finn is saying. The thing is here, a lot of people don't know because it's nobody's fault. It's what we're told, right? All of these oils for hair loss and all of this is nonsense. It's just places trying to make money, and there's a lot of misinformation online. And to be able to ascertain what makes academic sense and to be able to work things out requires years and years of knowledge, of being able to think in a certain way and having, the experience. And this takes so long, believe me. And there's so many components, have you done, like when I was in college, I studied molecular mechanisms of disease, and that has stood to me to this day because I will often recount on wound healing. I did some anatomy, I did biochemistry, all of these things. And to this day, and molecular biology, to this day, I will, apply what I learned from those modules to questions like this and work it out. And you can logically deduce. But it's very hard to work these things out. So it's nobody's fault who says, let's apply an oil to the scalp, because again, you'd have to know, firstly, you'd have to work in the pharmaceutical sector, know what active ingredient is. You'd have to know what the stratum corneum is. There's so many, you'd have to know the structure of the hair follicle and what are you targeting, and maybe have some experience with dealing with people who've used these things and being able to trend. So it's very it's a bloody minefield to navigate this industry. That's the problem. That's why it's nobody's fault when they, have the wrong information. It's just about finding the right information, which is very challenging. That's why I never want the comments to turn into a place where we have a go at each other or we criticize. I never ever want to see this in the comments. Everyone is on the same page here and everyone wants to just learn. I'm using dutasteride and oral minoxidil too, but I don't think I'm a good responder to minoxidil at all. My first move was oral Fin and topical Min for 8 months, but stopped Fin for 5 months and got worse. My question would be, how long have you been on the oral minoxidil? And my second question is, what brand? Because before I discussed sulfatransferase and how, with topical minoxidil, that can be an issue. But with oral minoxidil, you've it hepatically and in platelets, and this is why most people, nearly all of them, respond to it. And as well, how it's taken in terms of the path of that product. So it's swallowed, it goes into disintegration of gastric acid, dissolution, then crosses the lumen. The API facilitates this, so you have bioavailability that isn't compromised compared to the topical route where you have the percutaneous barrier and then sulfatransferase, etc. So I would be surprised when someone says, I'm not responding to oral minoxidil. And the first thing I think about is, well, how long have you been on it? What dose are you taking? Are you taking it at such a low dose that it's almost homeopathic? Or are you taking, a sensible dose, like minimum 1.25 mg? Are you taking it every day? Is it Lonitin? Have you been on it for at least 5 months? Because at 5 months, we should be seeing something, from that initial bit of hair growth. There should be more hold to your hair. You won't see it in the top section, but you'll feel more hold. Then haircuts are required as the months go by to be able to appreciate the benefit as the hair grows. To all friends, a little piece of good words. You didn't lose hair overnight, so do not expect to grow hair overnight as well. Yeah, that's so true. And, a lot of people they love the idea of a solution, a potion, a tablet, because, it's going to fix the problem. It won't. All it will do is improve things, and it's about a long-term view. So you got to think about this long term. You got to have a goal that you're going to reach in a few years. And the first step is, okay, I'm going to get on medical therapy. I'm going to get a prescription for finasteride, but I'm going to do this right. I'm going to get on, Proscar or Accord, something like this. Sticking a brand is usually the best, but the best generic, I believe, is Accord. And then I'm going to stick with that manufacturer. I'm going to take it in a blister format, and I'm going to take it either every day, or I'm going to take it on Monday, Wednesday, and a Friday, depending on what the governing physician, has issued, right? And I'm going to stick with that manufacturer indefinitely, provided that I'm getting a benefit from it. That's your first thing. And then you're going to come in later on, and you're going to take oral minoxidil, and then you're going to make this even better, and you're going to elongate anagen. You're going to thicken up the hair shaft. Your hair is going to grow longer. And that's the medication side of things pretty much done. And then the next thing after that is you're going to, if you're a candidate, pursue hair transplant surgery. And you're going to consider your techniques and the master plan, the long-term values. And you're going to create a value system, and you're going to develop your eye, and you're going to spot things like correct angulation, directionality in the front, and you're going to, imagine designs and look at people around you and see what is natural, and then think about all this, and then, become obsessive with the donor. This is a good thing. And as a result, then you'll make the right choices. And then the next challenge is, how often are you going to do this, and what's the long-term plan with your surgeon? How many are you going to need? What's the areas of focus? It's all case dependent. So this takes years and years and years. I've been, if we take in, aside from my transplants, I've been at this like 9 years to get to where I am. And it's an evolution, and it's a roller coaster. Things will not remain better. Things will not keep getting better, and they will also not remain constant for a long time, and things will dip. This is why, doing smaller surgeries are good, and, not doing just one massive one, and then just one massive one, and then that's it. Because if you do that, it's going to be downhill, well, forever. Whereas, the beauty of spreading out your surgeries and doing smaller sessions is you can kind of keep improving yourself, and you can sculpt your identity and tweak it. So there's, I think, a lot to be said from that approach. I'm completely against, on a personal level, I would never do a mega session. I don't agree with them. I don't think they're logical in any way. Yes, DK, wise words indeed. Do you think minoxidil from manual is good? It's pretty cheap here in Brazil. I don't know. To be honest with you, I don't know. I just take the original. I take oral minoxidil because it's by Pfizer. It's by $1 billion pharmaceutical giant. They have a pipeline of products. They have integrity to meet. They have a reputation and a name in my industry, and as a result, I know that they're going to produce a good product because it's a moneymaker and because their name is at stake. Manual is small fish in a big pond. Who are they? Why would I get a product from them? Go for Loniton any day. None of these small companies. It's also been around since the 70s, so they're doing something right. And it works. It just simply works exceedingly well. I've seen it in person now countless times. Do you know if it's possible to get oral minoxidil from a hair transplant surgeon in Poland? To my knowledge, no, you can't get oral minoxidil in Poland. But if you're in Europe, a prescription in one country is valid in another country, right? So I've helped a few guys with this in the consultations that I do, where you can travel to a country that has a market supply with your prescription from your country that you're in, provided that it is an EU country, and they will dispense it at the pharmacy. And you do this once or twice a year, and you turn it into a vacation period. So yeah, we started anyway the live stream talking about how to prepare for a hair transplant, and we've had a chat about things along the way, minoxidil, FUT, all of these things. If you have a few more questions, because I'll probably call it a night. It's 10 past 10 in Ireland. I might see my mate John if you're still watching. And yeah, hope it was interesting. Anyway, just to conclude, anyway, if you're new to it, look, if you're having a hair transplant, at the end of the day, the best preparation you can do is choose the right surgeon. So choose that guy who does both FUT and FUE and is a doctor-led clinic and does, the whole scope of the surgery. And that's the best thing you can do. The things that you have control of outside of that will be to, again, make sure you wear packed buttoned clothing. Wear buttoned clothing for 2 weeks. Don't take the risk. Just wear buttoned clothes until that fibrin is released at the graft site and it's fully anchored. And if you're traveling for this, spend a few thousand on nice accommodation. Do it right. Book. You're only going to do this a few times in your life. You might as well book something that you'll remember, that'll keep you, sane, because you cannot put someone in a bedroom for a week. This is cruel. Book a suite, right? Book somewhere where you have living space and that you can feel relaxed and treated well. It'll cost a few €1,000, but it's worth it. I do for every transplant. Look at this as a luxury approach. A transplant is a luxury cosmetic elective. Don't cheap out on anything. You're only going to do it a few times in your life. And the next thing is, in preparing for it as well, bring earphones. You're going to be listening to music through this period. It's going to keep you happy. If you have a laptop, bring it. Download Netflix or something like that. I don't watch television, so I don't know what's on Netflix. I don't watch anything like that. I just don't do it. But a lot of people do. So think about, what do you enjoy doing that is a bit sedentary for this period of downtime to keep your mind sane, whether you like reading or you just catch up with your friends or you love music or you're always flicking through YouTube. Just do that and take the adequate time off of work. This is essential. 2 weeks minimum. If you can take longer, do it. Get a medical cert. You don't have to put down it's a hair transplant. Just put down you're having surgery. You're not lying. You're telling the truth, and your employer they have to accept it. GDPR, folks, they don't have to find out what you did. It's none of their business, but you had surgery. You're not telling lies. So you can get a medical that's right for you, and they're not going to miss you. Don't be afraid, to take time off of work. As long as you're covered by that medical cert and it says you've had surgery, you've crossed all the T's and dotted all of your I's. So that is my advice. I'll flick through this, and if not, I'll call it a night. I hope you found it interesting. Okay, yeah, so that's kind of it. Going to close it off here. I don't know what we'll talk about next, but I'm sure it'll be something along the lines of the surgery side of things, because I think it's very interesting, and I think it's very valuable for the prospective patient.